Good afternoon and welcome to the Rotary Club of Kerrville. Appreciate you all being here with us today. At this time, I'd ask everybody to please silence their cell phone and mute themselves on Zoom for the wonderful presentation we're going to have today. Probably a little help that I could use somewhere down the road, but we're not going there today. At this time, I'd like to ask Todd Odom, who's already up here, to lead us in our prayer and pledge.
Thank you, Jeff Harris. Let us pray. Lord, we just thank you so much for this opportunity for all of us to be here. We have such a great group of Rotarians. And we just thank you for your love for this organization and for this town and our community. Bless us food, Lord, and help us have a good presentation, good meeting today. We give you all the glory in Jesus' name. Amen.
One nation under God, indivisible, with liberty and justice for all.
Jorge, got a little special song for us today?
We have a production number today, so if I can have all the volunteers come up, we're going to do Josh the Otter. I got a question though. In getting this ready, I'd never heard this song before, and I have no idea how it went, And so I asked Dave, send me the music so I can see it. And I said, let's put it on the board. He says, nobody knows how to read music. How many people in here can read music?
Used to could.
Wow. And so I gather that most of you cannot read music. So Dave is right. Well, anyhow, the song is 3 minutes long, but we're not going to do the whole thing. So we'll spare you on that. We're only going to do the first verse. And so this is what we do. We have eight schools we're lining up for second and third graders for Josh the Otter. And this is a song we're going to sing. So here we go.
Okay. You want to listen to it first or you want to just try?
Let's just try.
This is easy. Most of you got it. Not like me, though.
All right, here we go.
Come on.
Yeah, move the puppets, wave at the crowd, okay? Okay, ready? If you're a good son or daughter, be safe when you are in the water. You can be like Josh the Otter, learn to float. Learn to float, 2, 3, 4, 1. When it is hot and the swimmer, it's fun when you can fun together. If you're heavy as lead or light as a feather, learn to float. Off them, learn to float. Hey, good job.
Thank you, George. At this time, I invite Clint Morris to come up and introduce our guest speaker, who is probably working right now to have us all committed.
Thank you, President Jeff. When you hear about our speaker today, you're going to know that this is another great recruiting victory for the town of Kerrville. Our speaker grew up in New York. He went to SUNY Oswego and got his undergraduate degree. Then he went to Atlanta and got a master's degree in business administration. And then he went to Mercer University and got a master's in healthcare administration. He stayed in Atlanta for 30 years, was in charge of a major mental health facility there. And then guess what? He decided to find a smaller place to live, and guess who won? So we've got a great new executive director for our Hill Country Mental Health and Developmental Disability Center. Please give a warm Rotary welcome to our speaker, Todd.
All right, good afternoon. Yeah, it's afternoon. Good afternoon, everybody. Pleasure to be here today. Again, I am originally from New York, spent 30 years in Atlanta, ran a community mental health center there for 16 years as the CEO before transplanting to the beautiful Hill Country. I've been on the job I've been with the agency 7 months. I've been the CEO for 6 months. I have in addition to what Clint had mentioned, I also have a master's degree in social work. So I kind of got my feet wet as doing casework in New York City in some pretty dangerous neighborhoods back in the 1980s. So I'm gonna pull up a PowerPoint presentation here. There you go. All right, and then where is the advance? Is it this? Yeah, why don't you, I'll just tell you to move them. All right. Okay, so I want to, let's go to the second slide. Okay, so I want to talk with you about Hill Country. I don't know how many of you are familiar with the organization. Hill Country Mental Health and Developmental Disability Center. I'll give you some background. It is a nonprofit governmental organization. There are 39 of these entities all throughout the state of Texas. We are considered safety net organizations in that we serve mostly an uninsured population and then also folks who are on Medicaid. You got a good number of folks in Texas who are uninsured. If they have mental health issues, they would turn to us for service delivery, and we kind of ensure that as the safety net entity that they don't fall through the cracks. Most of our mental health services, we serve children and adolescents. Most of the kids we serve are on Medicaid, and adults in what's called ambulatory outpatient services. So it's, typically it's the working poor who knocks on our door for care. They may have some situational crisis in their life, suffer from depression, may have what you hear about is what's called bipolar disorder. Some of the more severe mental illnesses like schizophrenia or schizoaffective psychotic thought disorders. We will serve folks who run anywhere along that continuum, that gamut from kind of the most intense mental health sorts of issues to some of the most complicated. The organization was created by Texas statute in 1997, and we were reformed as quasi-governmental entities at that time. So we are governmental entities, and we're also 501c3 organizations. So we're kind of a unique bird. And I've never seen anything like a Texas community mental health center in their quasi-governmental status. The community mental health centers they're present in all 50 states. About half the states, they are governmental organizations, usually some form of county government. And then the other half of the states, they're private, not-for-profit 501c3 corporations. We also act as what's called the intellectual and developmental disability service provider for our catchment area. So we serve folks who have IDD in a variety of different services, what's called rehabilitation services, where they may come for different sorts of skill training. And then also we have some group home facilities, residential facilities. Hill Country geographically, it has a spread of 23,000 square miles. So of the 39 centers in the state, we are the second largest geographically. So we extend from the I-35 corridor with Hayes and Comal counties, and our service area, and I'll show you in a map in a second, extends out past Del Rio and Valverde. And so it's 19 counties. It's just really going from suburbia into the rural and frontier areas. It's really a challenge as a safety net organization. And I'll talk more about that in a minute. We employ 430 staff. Presently, we are confronted with some of the challenges that other organizations, whether they be healthcare or not, in line with bringing people on board, staff, and we have 100 vacancies in the organization. And I think about 50 of those positions are right here in Kerr County. So we are doing things internally in terms of trying to, create incentive packages for people to come to work for us. But hiring right now is a real challenge, and it's having some impact on our ability to keep up with the need. You go next slide. Okay, this is a map of our catchment area, and this map is pretty telling. This shows the 19 county area. The key that you see on the lower right hand shows where our whether we have a mental health clinic in a particular community, a developmental disability day habilitation, or a work center. The yellow star is where we have our developmental disability group homes, and then in Kerr, we also operate what's called an adult crisis stabilization unit. But 19 counties here, we offer in-person services or telepsychiatric services now as a manifestation of the pandemic. A lot of healthcare has been shifted to video delivery. I'm sure some of you have experienced that in your own lives with your own healthcare. And so of the 19 counties, we have services present in 11 of those counties. So again, a combination of about a dozen mental health clinics. I think it's 8 day habilitation centers for folks who have developmental disability centers, and then 16 group homes for individuals who have a developmental disability. And then, of course, there is the adult crisis stabilization unit, which I'm going to talk about in a minute, which operates out of Kerr County. So I'm going to give you just a little bit of background. I'm also making a plug here for to make you aware we are a large employer. And so we, in our communities where we exist and where we have staff, we are part of the economic engine of those communities. So but this is kind of a telling picture. It is human services. There tends to be a decent amount of turnover in the first couple of years, but this is a slide of our 430 present employees. So we have 149 people who've been with the organization for less than 2 years. Within the first 2 years is where we experience our kind of heaviest turnover. But so the number of folks who've been with us for 2 years, and I have 2 of my employees here who've been here for just several months and who are Rotarians, is about 1/3 of our workforce has been with us for less than 2 years. And then you see the number of folks, a little over 100 have been with us for a couple of years to 5 years. And then the number of folks who have been with us over 5 years, 176, which makes up about 40% of our workforce has been here, our longer term employees. So we are a big organization employee wise. You see 430 people here, got another 100 open positions on the books, which we hustle to fill. But there's always a demand for, because of the turnover in the first 2 years, to continue to hire. I'm going to give you some idea of what our service delivery looks like in the breakout of the 19 counties. So again, it is, like I said, it's 23,000 square miles. Hopefully you can see this. What I want to show you, these are the 19 counties and the number served by county. Our top 3 largest serving areas, and this makes sense, of course, are Hayes, Comell, and Kerr County. This demonstrates presently on our books for individuals who have a mental illness who are receiving outpatient services, about 9,400 people. Of the 9,400, 6,250 of them are being served in either Hayes, Comell, or Kerr County. Those are our densest population areas. Again, the 2 counties on the I-35 corridor and us in Kerr as you're coming out west. And then from here, we're going west into the rural area and into the frontier, all the way out to the Del Rio area. And this is, I want to also give you a little bit of data information in regards to what our service has looked like for the past couple of years. So in fiscal year, this is again the 19 counties, and in fiscal year 19, just a couple years ago, we served 8,490 people, and then we head into the pandemic. And then you see, which is really kind of interesting because the pandemic impacted our service delivery in our clinics. So most of our services are delivered between a clinician, like a therapist or a psychiatrist or a clinical psychologist, and directly with an individual in a face-to-face setting in the same room. We shifted very quickly when the pandemic slammed all of us into a tele-behavioral healthcare where 90% of our services were delivered virtually. And so we increased during this period of time, we increased the past 3 fiscal years, serving about 8,500 a year to serving 9,800 people up until this past fiscal year. And what is most interesting is that we did serve more people, and maybe that would be expected in regards to some of the side effects of the pandemic, is that folks were feeling the challenges and isolation. Mental health roles with organizations like ours all throughout the country saw increased service delivery, but they also saw, in regards to the number of services per individual, the number of services that each of them received decreased during that time period. So an individual during fiscal year 1999, on average, we may have been providing 5 different services per individual, and then it decreased to, let's say, a couple by the year 2021. I want to mention also, I stated earlier that in addition to being a provider of services, we are a local authority for developmental disabilities and mental health services. So these are roles that we take on really in contract with the state as an overseer of care, which is a very unique position to be a provider, a direct service provider, and then being the overseeing entity with governmental functions. It's a unique cup of tea that I inherited. I'm not particularly in love with it, but it is what it is, and I think we do a very good job with it. So we operate the what's called the LIDA, which is the Local Intellectual and Developmental Disability Authority for the 19 county catchment area. And basically we do, in partnership with the state, we will help folks who coming out of high school who have a developmental disability. They will apply for a Medicaid waiver to be able to access services for their healthcare challenge, their IDD situation, and then they will go on a waiting list waiting funds from the state for their Medicaid waiver, which then they can go and access services. We have we as a developmental disability provider, we serve about 200 individuals. The LIDA oversees care for about 1,000 people in the region. March is Developmental Disability Awareness Month. It was coined this by President Reagan back in the 80s. So this is just for all of you to be aware that this is a very important month from what we do in our business. And as acting as both an authority, we are also in kind of the awareness business. So part of my being here today is to educate you all on the individuals we serve, and so let you know that this month is Developmental Disabilities Month. Yes, sir. In regards to, these are the different locations where we have residential programs. We have 16 group homes, which are 3 or bedroom houses, which house people who have developmental disabilities in the Kerr, Comel, Valverde, Gillespie, Hayes, Llano, and Uvalde counties. And so they are routinely full, and our 24-hour-a-day, 7-day week program that we staff with our staff. And we've been in the residential group home business since 1997. In regards to rehabilitation centers, we have Again, in 8 counties, we have what's called it's a special opportunity center. We operate one in Kerrville, but these are day programs where individuals can go who have a developmental disability. These were during the pandemic, often with individuals who have developmental disabilities. They also have some comorbid other health conditions. So they were removed from congregate group settings during the pandemic. And so they were not attending programs for quite a while. I want to talk about the Crisis Stabilization Unit. So one of the unique facets of Hill Country Mental Health is we operate one of only 4 in the states, an adult crisis stabilization unit. So in many respects, it is a 16-bed program, which is housed on the campus of Kerrville State Hospital. We rent space from the state hospital, and it really is in many respects the equivalent of an inpatient psychiatric unit. So it's where folks come, mostly originate, they're in some sort of psychiatric distress, and they will often end up in an emergency room or sometimes in the back of a law enforcement vehicle because their crisis is manifested so acutely, and they are just in dire need of services. So we have this program. This is some of our employees, very dedicated staff that work in this crisis unit. The average length of stay is about 7 days. We take people voluntarily, but also involuntarily on what's called an emergency detention. And this is the state of Texas there are too few of these facilities and too much reliance on state hospitals. And so it is my hope, and in another slide or two, I'll show you some growth in the acute care environment. This would be considered our most acute restrictive level of care, where basically, someone who is in such a high level of need is placed in a facility away from the community until they're stabilized for a period of about a week. We have in the plannings, we have a youth respite crisis center. It's a house we rent. It's in San Marcos. It's a program for kids who are in deep psychiatric distress. It is an alternative to hospitalization for these kids. It's a residential program. We had operated it and lost the funding for this program right at about the time the pandemic came about, when we just identified some new funds, but we've got it in the works to re-engage this program, and we have job openings. So we've got job openings all throughout the organization. I had mentioned about the Adult Crisis Stabilization Unit. I think in regards to what, in my first 6 months on the job, the area of focus that is most in front of us right now as an opportunity is the creation of more acute care type facilities. In Comal County, we have a county commissioner. She sits on our board of directors. She has been a very strong mental health advocate. They're going to utilize some of their ARPA funds to build a 16-bed facility which is the equivalent of like a crisis stabilization unit. And they are turning to us. We will go to the state to apply for funding to staff it 24 hours a day, 7 days a week. So we will, in partnership with a local elected state representative, make a pitch to the state to apply for funding for the operational support to hire the staff and the physicians and the nursing staff for this facility in Comal. Very similarly, in Hayes County, the county judge has been a very strong proponent of mental health safety net as well. The county commission, and again, we are the safety net provider for these 2 counties. He has, through the county commission, they have authorized the expenditure up to $250,000 for a pretty wide scale needs assessment, but they want to utilize ARPA funds up to the tune of possibly about $25 million to build a psychiatric facility. And potentially they would like to utilize us to staff it. So we would be going to the state legislature for funds to staff this facility, if that's how it all works, whenever the results of this needs assessment come out. And then in Uvalde County, long in the planning, This is my predecessor. This was really kind of his prize project, was the building of a 42-bed psychiatric hospital in Uvalde. And a request was made through a, kind of an earmark initiative through Congress for $25 million. That did not fund, but we are getting word that a couple $1 million funded. And so this would be really, as there is a dearth of psychiatric services in the rural and frontier areas, as you head kind of west from our service catchment area. This is garnered a lot of support. The Uvalde County Judge and the mayor have identified public land that they would lease to us for like a penny for a century or something. And then we have done some work with some architects in regards to building some renderings around drawings around a 42-bed psychiatric facility. The present discussion with the board of directors is that will probably be pared down. And that is some anxiety about the total price tag of this, what was once a $25 million project. But the staffing of the facility in Uvalde would require 140 positions. And with what's going on in the workforce right now, your guess is as good as mine. We feel like we would never open the facility because we wouldn't be able to find the staff. So we're looking at a much pared down vision of this, of probably maybe about a 16-bed facility in Uvalde. And on the outpatient ambulatory side, it's kind of accreditation is a big deal in healthcare. And for the Texas community centers, they are all required to have what's called certification as a certified community behavioral health care clinic. It's a requirement. If you don't obtain your certification as a CCBHC, my understanding is they'll put you out of business. We were awarded ours just a couple months ago. We scored 97% on the compliance review, which was second highest in the state. So we were very proud of that. But this was kind of a good seal of approval and accreditation for certification for our community behavioral health clinics, all of our outpatient ambulatory services. And we've been, we have here fellow Rotarian, new Kelsey Bijat is on board with y'all and here today. She is our Director of Community Relations. She's done an outstanding job of getting us in front of the media. So we, in line with what I'm doing today, we create awareness about the importance of mental health programs. And so we've been featured in the news quite a bit within the last 6 months. And I want to say thank you for the opportunity to get in front of you all today. It's been my pleasure. And I don't know if anyone has any questions. Happy to take on some questions. Yes, sir. Yeah, so it's really, it's kind of all over the place. So we've got positions for receptionists, which would be like high school level folks. We have in our direct service professionals, those are a combination of folks who have high school degrees, but also college degrees, but and folks who have master's degrees and who are licensed. And then we are recruiting for a full-time psychiatrist. So we've got everything from, right on the very front line of service delivery, right up to, a physician who makes 6 figures. Yeah, we are in the same boat with everybody. We have a psychiatric, the majority of our services, you saw the 9,400, the slide of the 9,400. The vast majority of the folks who come in for service delivery with us, probably our highest service that we provide is psychiatric medication services. So access to psychotropic medications. We have, for the 19 counties, we have a prescriber staff of 14 people. So those are psychiatrists and then nurse practitioners. We have 10 physicians, and we're concerned because our psychiatric workforce is, other than one physician, everyone's 70 years old or above. And we're not seeing folks come up through the ranks in regards to the medical schools for psychiatric residency. So we do employ nurse practitioners, psychiatric nurse practitioners, but it's just as competitive to get a nurse practitioner as it is to get a psychiatrist. Yeah. Yes, sir.
Okay. Can you just clarify for a lot of people in this room, Kerrville has had this stigma forever that when the crisis intervention center lets somebody back out forward, they're being released from the Kerrville State Hospital. And we all know, there's lots of us that know that it's not.
Yeah.
But that is something that has been over Kerrville forever. And even sometimes our law enforcement say, take us safe, release the patients. We take them, they release them. And that's not the case.
Sure. Yeah. So I mean, that's a good point. I mean, so Kerrville State Hospital has folks from all over the state, and they're responsible for their discharge planning. That is a forensic hospital. It has a 5-year length of stay. We take folks, of course, all through our catchment area, with most of the clients coming out of Kerr County, Hayes, and Comal counties. Those are the biggest referral sources into the crisis stabilization unit. But we are responsible for the continuity of care where folks go to for delivery afterwards. So if someone comes in from Comal, we're responsible for hooking them up with our outpatient services in Comal. The idea is we shouldn't have folks malingering in the community in Kerr upon discharge. So, but I will mention it because I sit on the quality council for Kerrville State Hospital. I'll make reference to your comment, if that's all right.
Oh, fine.
Yeah, okay. Yes, ma'am.
So, okay, I think you touched on this and I may. So y'all office at the Special Opportunity Center, can you coordinate with, where's your office?
So we have,
It sounds like you kind of have your.
yeah, we have our headquarters are at 819 Water Street. The Special Opportunity Center is almost like right across the street from Peterson Regional Medical Center. So that's where our developmental disabilities program is. And then we have group homes that are in residential areas, but just a couple of them. Yes, sir.
Said you mainly serve the working poor. Is there your clientele, your homeless?
So yes, there would be some of our folks who would probably, I would more probably define that they're in transitional housing, that it's not secure, than they are full-blown homeless. Like we don't have homeless outreach activities, but we do have folks who will come to the clinic on a walk-in basis for an appointment to see a clinician. But it's most of our folks are domiciled, they have a place to live, but it's, kind of the picture of a family of 3 or 4 living on a salary of $25,000 a year, and the husband isn't offered health insurance. Yes, sir.
Yeah, you talk about some of the crisis situations like kids or whatever. Did you say that the youth crisis has 6 beds or something?
Yeah, yes, uh-huh.
Well, what happens if you get a 7th kid? What happens to the people that receive your pass?
Sure. So now I don't believe that ever happened when we were previously open. Likely a child would be hospitalized because they're at that high acuity level. So the idea is the crisis respite can be a diversion away from hospitalization, which would be more traumatic for a child than being placed in a residential setting for a short period of time until they're stabilized.
Do you see a lot more? And I ask because I know 2 kids, like the 12 group, trying to commit suicide. So do you see a lot more of these kind of crises today than you did 4 years ago?
I would say nationally, we're seeing an increase in regards to these acute exacerbation of kids in crisis. And that's not just, what we're seeing in Kerr County, but all throughout the country. There's a lot, family challenges, there's a lot of different aspects. Kids coming from divorced families, that's escalating. We will see kids in crisis and, acting out some issues that are going on in the family. So it's a myriad of this. School stressors. We saw quite a bit of on our call intake when the pandemic impacted the schools, quite a bit of acting out by kids when they were, when everyone was outside the school setting. So, yes, sir.
Do y'all have any overlap in services with the Kerrville State Hospital?
We are, other than having a relationship with us, we kind of have two separate populations. So they are long-term state psychiatric hospital patients, and ours, someone may have been hospitalized at Kerrville State Hospital at one point, and then we now follow them on an outpatient basis. So it's kind of it's a relationship, but we don't, like our crisis stabilization unit is a short-term acute stabilization period of a week to 2 weeks, where the average stay at the Kerrville State Hospital, because it is a product of their mental illness and that they've committed a crime, that they end up on a forensic unit. Yes, sir.
With Kerrville having the highest veteran population per capita in the state, are y'all seeing an increase or a decline in veterans coming through your program, or?
We haven't seen any change in veterans, and we take a look at it. I think part of the benefit, of course, is that you've got the VA right here, so there is some service delivery available locally. Yes, ma'am.
Can you just define the process by which someone goes from being in crisis to the CSU? And I'm asking that because I've covered a bunch of stories from law enforcement saying that they're I don't know if we understand what that process is. They say that they're transferring them out almost daily. So can you explain the process from I'm in crisis and now I'm at the CSU?
Yeah, so most of the referrals, the admissions to the crisis stabilization unit, and we had to cut down our capacity at the crisis stabilization unit during the pandemic, just for a variety of reasons. At one point we cut the census down to 8, and the 6 clients we had on the unit all had COVID. So we had to shut off all admissions. Most of our admissions to the crisis stabilization unit originate out of emergency rooms. Some are they are remanded in as via an emergency detention. Law enforcement gets placed in a very precarious position in regards to all this, because they end up de facto, very unfortunately, in the transportation business of the mentally ill. That's going on all over this country. And it is a real challenge. I hear from the sheriff's offices throughout all the 19 counties we serve in regards to this issue. Fortunately, the Kerr has the benefit that the CSU is right here. Transports, if you're out in the hinterland trying to bring someone here in the back of a law enforcement vehicle, it's a much longer ride. So, but this is a challenge all over the country, this issue. Yeah. Okay. All right. Thank you all.
Todd, thank you very much. He will be available for questions after. So if anybody has some, couple of, club business now. Families in Rotary, if y'all would please think about and keep Brian Bowers in your thoughts and prayers. I don't know the extent of it, but he had to have surgery because he hurt himself on spring break. So that's the only one that Stephanie told me about, but please also pray for the world. Pray for the ongoings that are going on right now. Pray for our Rotarians and our fellow humans over in over in Ukraine right now, and for our leaders, so they can hopefully come to a peaceful resolution with everything that's going on. If y'all remember back in, I believe it was October, there was a group of us that stood up in front of you that were named to be your new board of directors. This is a approval from the club that I'm fixing to ask for everybody that is part of the process. But Marta Deffin, who is not with us today, she's obligated over at Shriner, will be your incoming president. And she's online. Thank you. Jeff Wendling is going to be our president-elect. Christy Shepard, who's out here with us in the audience, will be the secretary of the club. Gina Daniels, who I think had to sneak out, will be the treasurer. This guy I'm not too sure about, but the past president will be myself. And then your board of directors are going to be Roy Boudreau, E.A. Hoppy, Todd Odom, Janelle Peralt, Donna Peterson, and Phyllis Ricks. At this time, I will ask for club motions, club votes for all in favor. If you would, please raise your hand or say aye. If you oppose, will you please say nay? And if there's any that abstain. Perfect. Looks like we have your board and your officers selected. So thank y'all. I'd also like to say a thank you because it's not said enough. And those of you all have stood up here and done this, you know what a challenge it can be. But I'd also like to recognize Robin Myers and Tammy Prout, who will be rolling off the board. And thank y'all for your service to the Rotary Club. Behind the scenes, they've done so much. And I know that Tammy did so much with Marta for the main event this year. So it's we can't say thank y'all enough. And Robin, thank you for being on my board. You'll see some flyers on your table. Rotary membership. Bring a prospective club member. Bring a Rotarian. Let's drive our numbers up. Let's finish the year strong. Let's we wanted 20.
I have applications for people who are sitting kind of close to me. There's someone on the other side of the application. That would be great.
And we did get a new application today
Yes, we did.
for Dr. Sosha. So Todd and Mike Huff, thank y'all. Rotary Day of Service is coming up Saturday. T.O., you want to give a real quick little?
I'll tell you, I know it's an extra one. We just picked up our normal trash collection we do over on Good Creek, but we are.
Come up here and stand in front of the camera.
Okay, okay. Oh, my goodness.
Let everybody see it, Todd. Come on.
We'll put a card here in front of the camera. Oh,
Well,
my goodness. Hold on.
We got a hook too.
Oh, my gosh, look here. Oh, my gosh, I'm on it. I'm on it. But we're gonna have a good time on Saturday. We're gonna meet at 7:30 at Lewis Hayes Park, right below the bridge there. We're gonna have food and drinks before we get started. We have a lot of the Interact kids from the high school there, and I think our evening or afternoon group's gonna be there as well. And we'd like to have y'all, many as can make it, out to Lewis Hayes Park this Saturday at 7:30. And it'll go quick. I think 45 minutes, an hour, we'll be done. And we're gonna pick up some trash, have some fun. If you got relatives or people in town, bring them with you. Hey, trick them. But come on in. But look at this. Hey, look at this. Look at these vests that we have. Look at that vest. Is that showing up today? Is that on there? In the back? Man, look at those good looking vests you get to wear. That's limited edition right there, folks. Come on. If you come enough, we'll get your name put on there. But y'all come, we're gonna have a good time. We appreciate all the hard work. If you got a littering problem, that's sure solved it. We appreciate it. See y'all Saturday.
Thanks, Tom.
Trick them. Veterans Breakfast is coming up. It will be April the 15th, Good Friday, 8 o'clock to 9:30 at the Veterans Center. So looking forward to celebrating all of our veterans with us here in town. First Responders Golf Tournament. We need some teams. I've got people that are saying they're going to play. We don't have teams yet. We have a great number of sponsors that are helping out. And Mr. Tallarico, you're one of them. Jeff donates about $2,000 worth of golf balls every year to the cause. So that's an amazing thing. Thank you. And they're good. They're not knockoff pinnacles. So, following the golf tournament that will be on Monday, the 25th at River Hill Country Club, with registration starting at 11 o'clock with, where's she at? Amber, are you still here? Oh, yes. Amber's going to be manning the registration table. Dave Rittenhouse is going to be manning the registration table. Christy Vandenberg's going to be running her world famous putting tournament that we always do. Absolutely. They, but that's on Monday. 2 days later, we're going to be honoring our first responders here. So please, plan on being here for the 27th lunch. It'll be in the gym. So instead of coming in and taking a right, go and take a left. And, we're looking forward to that. Before we get to it, I'm going to say a special thank you. She's not in the room, but, y'all all know Donna that works here. Donna just kind of socked us in the gut a while ago. She's leaving. So if y'all see Donna, thank her for everything she's done, because I know the Kroc Center's been phenomenal to us, but Donna comes in, she knows everybody's names. She's been great. She's had the opportunity to go somewhere that's a better stepping stone for her, a better position. But when y'all see her on the way out, if you just say thank you, and we're going to miss her. But all right, Jeffrey, you got some gifts that you want to announce today, sir?
4 minutes and 32 seconds. For cleanup on Saturday, after you complete that, there will be a tattoo. And Todd will have the tattoo truck over there, so y'all make sure you line up, okay? All right. And for those of you who are not from New York, for those of you who don't watch the news, if you didn't recognize Bill Barr, our former Attorney General. Wow, right? Wow. Right? Do you hear the syntax of how he spoke? It reminded me of my old life.
I think you might have just gotten to bed.
Anyway, thank you so much for being here. What a great change. Thank you. Yeah. Atlanta had a great effect on you. Okay. On a sad note, Monday morning, Commissioner Buster Baldwin passed away at 2 a.m. in the morning. And so we're looking forward to honoring him at some point. I don't know who's doing the, I'm sorry. Yeah, services and things like that, memorial service. Paula, where's Paula? There's Paula. There's Paula. You going back when? Okay. Bring wine back. We need wine when you come back from Sonora or wherever you're going to go. Christy, you have gifts, please?
Yes, I'd like to introduce my friend. For those of you who don't know her, she is a past district governor. She lives up in Junction. This is
Righty. Carlene said this was a little messy, and it is. David Reese, you have Good. Janelle, Chris is still with you today. Standing. And city manager, you have somebody that knows you pretty well there as a guest. Welcome. Jeffrey?
Kind of sitting close to our district governor that Christy was pointing out a while ago that she has an application for. Tara is with us again this week, 2 in a row. So thank you for being here again. All right. One more announcement on my part. And Judy, I hope I'm not overstepping my bounds, Mr. Mayor, EA. City Council has a meeting on the 12th at Council Chambers at City Hall, 6 p.m. And there's going to be a proclamation made by the city for Allen Hill. So if y'all want to be there to support, the family's going to be there. So if y'all want to show up to support Allen and his family and everything that he did great for our veterans in Kerrville and Kerr County, please be there. So fun part, Philip Stacy, are you wearing a tag? Are you wearing your Rotary pin? No, sir. Oh, Lord. So, Mr. Hoppy, do you have one of your Rotary pen?
Yes.
Yes, we do.
I'll be in the picture. I'll let you. No, Harry, I got it. Look, here, you do it.
Little wine for you, sir? Sure. I thought you were gonna be in the picture. We gotta present to him. I'm just trying to follow in your footsteps, sir. Thanks, sir. All right. That's always the fun way to end. So if there's any club business from the floor, Janelle? April, the first week of April at the, at the trailhead. At the trailhead at Shriner University, Monday, Wednesday, Friday, first week of April, water trees. Thank you, Ashley. You've already signed up. Yeah. So it's a awesome deal. Anything else? If not, if you would, please stand and join me in the four-way test. Of the things we think, say, or do, is it the truth? Fair to all concerned? Will it build goodwill and better friendships? And be beneficial to all concerned?